are watching Over the Back Fence, a conversation among neighbors. This is a production of Neighborhood Falmouth. Our conversationalists today include Jackie Pratt, Mary Pat McKenzie, Mike Bahari, and Marion Bahari. And I'm Susan Laux. I'm the host of Neighborhood Falmouth. I'm also the director of Neighborhood Falmouth. So our topic this time is the effect of drug advertising. So it's a very broad topic, but I'm sure there are opinions about this. The world changed, I think, when the US started accepting advertisements for drugs in magazines and on television and radio and so on and so forth. And I'd be curious whether that changed anything in your life or your work or in the way you even thought about medications for you or your loved ones. So Mike, you are not a regular here, but we're really glad you're here. Maybe we should start with you. Do you have thoughts about that?
Oh, I have lots of thoughts about it. And partially because I worked in the healthcare system for a long time. I'm a physician and a healthcare consultant, and I actually worked for a large drug company for a year. And I spent about 12 years working for large HMOs, health plans. So I have a real understanding of how prices are set, what the advertising thing is. And I'm currently reading a book called The Empire of Pain, which is the history of the Sackler family, who, were the manufacturers of OxyContin. But before that, they were very much involved in the marketing of Librium and Valium. And they essentially invented drug advertising.
Yeah.
Way back. There was no drug advertising, maybe in, ladies' journals and things like that, there'd be snake oil advertisements, but not for, licensed prescription drugs. And they were the first to actually start advertising in medical journals aimed at doctors, advertisements. And the first one was for terramycin. And
What is
they
that?
terramycin terramycin is an antibiotic
Okay.
that came out after World War II, late 40s. And and it was an antibiotic, but they so heavily advertised it to physicians that it became the best-selling antibiotic in the country for a while.
Question always about the advertising, because I am aware that we and New Zealand are the only two countries in the world who allow advertising of prescription medication.
Right.
Do you think people asking for, give me an antibiotic for that, even though it might be for a treatment that an antibiotic is not effective, does that, can we nail that directly back to the SAC?
Well, it's complicated because what happened, the initial advertising was to physicians.
Right.
In print media. And then they moved into regular magazines and newspapers when they started pushing Librium. And they were very smart. What they did was they didn't say necessarily the drug was going to cure X, Y, and Z, but they would talk about, and it was really geared towards women, those two drugs. And they would show, one picture of a woman down in the dumps and then another picture of a beautiful woman in a sexy bathing suit, and there was this whole subtle advertising thing. And the Sacklers who did this not only had contracts with the drug companies, they owned the advertising agency, and
Yeah.
they owned a publishing company that published medical journals.
Oh, wow.
So they had the whole thing. And what happened is that when they started advertising in magazines and newspapers, they created a demand, for the drug. And so, patients began then to come to their doctors and say, I want a Valium. And every time someone came to the office and said, I don't feel well, I'm tired, or yada, 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 they got a prescription for Valium. I mean, for a while, it became one of the top selling drug in the country, brand name drug. And then the next big step, which really put the nail, I don't want to say nail in the coffin, but
Go for it, because
Go
it
for it,
does
the
put
nail in
nails
the
in
coffin.
coffins.
Was although it was allowed in newspapers and stuff, and magazines, it was not allowed on television.
Till 1987, wasn't it?
Yeah, the late 80s. And the first big company to really take advantage of this was a company called Schering Plough, which is now part of Merck. And their drug is they had a antihistamine that didn't cause sedation called Claritin, which nobody really knew about, which they, promoted to doctors. It had maybe $2 million a year in sales, which is very little for a mainstream drug. And they were the first ones to start this advertising campaign on television. They pushed and pushed against the FDA. This is where the FDA came up, where you had to put all disclaimers in the ad, that kind of thing. But within 1 year, with a combination of blitzing television and really, really selling this to doctors, it went from $2 million to over $2 billion. And
it wasn't even that great of a drug, right?
no. And that was the drug company that I worked for. I lasted for about a year until the evil empire became too much. But the cost of the advertising was dramatic. And that gets into the price, that patients wind up paying. Along with this is how we pay for drugs in this country. So it's not just the advertising. The advertising creates demand for a drug. And the advertising costs get built into the cost of the drug. But we are the only large industrial wealthy country that has no drug regulations in terms of pricing. The European bloc, the European Union nations, Canada, and Australia, a number of other countries, including New Zealand, regulate how much can be charged. And the countries that have national health services, they buy the drugs directly. And because they're representing the whole population, they can negotiate, which is why on the average, drugs around the world are less than 50% the cost of the drugs here. And for some drugs, it's like a 70 or 80% difference.
Yeah.
And we wind up paying for it because the profit margin's so much greater here.
And yet I have heard the argument made, it's because, we have to protect the copyright, we have to this, we have to that. But you know what? The copyright's protected in Canada. And
yes, it is.
I'm a
And
Canadian.
I gotta tell you, if the United States
I
went
grew
away,
up under it.
they'd still be
patent maybe
they're
is the
still
right
making
word.
a profit in Canada and in Europe.
Yes.
The issue here is no government regulations. Um, and we have a patchwork system based on the free market.
Mm.
So a drug company can charge whatever they want. That's number one. Number two is we get our healthcare through a large number and patchwork of health plans, private, government, Medicaid, Medicare, the Army or the armed forces. Um, and the third thing, and the one that's causing the most increase, are what are called pharmacy benefit managers, or PBMs. And what happens is when a drug company wants to sell its drugs to a health plan, and I think you all know health plans have these things called formularies, which are the drugs they'll pay for. Well, for a common disease like diabetes, the companies, and there are three that manufacture insulin, want to be on a big HMO's, formulary so that their drug gets used. And the middleman are these PBMs, which have become extraordinarily powerful. And they're the middleman between the drug companies and the health plans. They negotiate, and the negotiations include getting more money out of the drug company to give rebates or kickbacks to the health plans. So what happens is let's say you have a drug that costs $5 to make, and the list price set by the drug company is $10. So they get a profit of $5, which is fine.
Fair.
And they can do whatever they want with that $5. But now, because of the PBMs, they can't go directly to the health plans or to the pharmacies. So they go to one of these PBMs, and the PBM first takes about 5% for administrative costs. So that immediately increases 5%. Then the PBM goes to a bunch of health plans and says that, Eli Lilly, has insulin and they want to be on your formulary. So the health plan says, what do I get out of it? And they say, well, we'll arrange for a rebate.
They go to the
All
health
about
plan
money.
itself, not to
So it's essentially, it's not a bribe, but it's legal. So they can come to Harvard Pilgrim and say to Harvard Pilgrim, Harvard Pilgrim can say to the PBM, we want a rebate. And what happens is these rebates are sometimes 35, 40, 50% of the cost of the drug. So you now have a $5 drug. The drug company lists it for 10, but they raise the price a little bit because they've got to pay these administrative costs to the PBM, and they have to somehow, deal with the rebates. So they may now charge $12 or $13, but the health plan is getting money from the PBM, and the PBM turns back around and plays the drug companies off against each other. So very often what happens is $5 drug, which normally would sell for $10, the health plan is winding up charging $50 for it. And what happens is everybody makes money and the patient gets screwed.